Okay, it looks like this. It's an oversimplification, but there are two ways to make moral judgments. We can either judge people based upon their intent, or we can judge people based upon their outcome. If we were to judge solely on the basis of their intention, we introduce this problem of moral hazard. Well, I did bad things. I put other people at risk, but I didn't mean to. So I'm not morally a bad person because I had good intentions. I'm a good person. That's the fallacy of judging solely on intent. The fallacy of basing on outcome is moral luck. If I have nefarious intentions, but I wind up doing something that's good, and you judge me solely on the basis of my outcome, then that makes me seem like a good person. The difficulty is when the intention and the outcomes are so convoluted, they're so complex that they don't align. People can have one type of intention and result in a different type of outcome. We cannot judge solely on the basis of intent, nor can we judge solely on the basis of outcome, because if we do one, we introduce this problem of moral hazard. If we do the other, we introduce this problem of moral luck. And we're managing a complex, emergent, exponential, nonlinear system like a pandemic. Both judging on the basis of intent and outcome will fail us because the outcomes and the intentions are not going to align. How should we make judgments about the values being expressed in policy statements and in personal actions as we see them, as they are revealed by people's behavior in response to the pandemic?
Of course, moral philosophy is organized around the distinction, or you could argue that it could be organized around the distinction that you just laid out. And when you look at the intent, it takes you right back to Aristotle, right? Aristotle, virtue ethics, Confucius, right? Confucius, and which says there are certain virtues, and these virtues drive ethical decision making. The right thing to do is that which comes from a virtuous mind, of virtuous intentions. Courage, humility, generosity, those are typically held up as virtues. But as you suggest, say that you're supremely virtuous in this, as many healthcare workers would be, right? They are generous, and there's even other ethics, of course, in the duty ethic. We'll get to that in a second. But suppose you have the virtue of being super generous with your time and your skills, which brings you into contact with a whole heap of infected people, which then knocks you out. So the outcome is pretty crappy, ultimately, for everyone, because it knocks you out for helping others as well, right? So I think that's a beautiful illustration of the point you just made, which is if you focus on one side of that supposed moral philosophical equation, you end up in trouble. This is where we need to start thinking about the schools of thinking that are consequence ethics, and that's exactly, focus on the outcome. The thing is the right thing to do if the outcome is good. Now, that's a hugely negotiable proposition, of course, and you get into very slippery territory immediately. When you look at, for example, contract ethics, right, or contract theory, which would be Thomas Hobbes, right? We're incredibly brutish, and life is short, and it's nasty. And if we don't have a sovereign who can both help us write contracts together and then enforce them, we're going to end up in dark, pre-medieval places. And so this is where the Leviathan, where he writes about social contract theory, would suggest that there's a massive failure. No, you could make the argument that there has been a massive failure all along, but which becomes extremely visible now in neoliberally run countries, in the social contract of providing healthcare to your own people, right? And we could elaborate on that a lot. But so there's multiple angles we can take on this, but I'm eager to hear from Dave as well, obviously. So,
well, the first thing that hits me always in these discussions is the great Greene quote from The Quiet American of being, impregnably armored by his good intentions and his ignorance. Because we've seen that so often in system safety. People using intent as a way to excuse their responsibility to look ahead, to dig into, to look for, to be proactive in identifying and diffusing potential risks before they turn into harm. I mean, I've stated for 20 plus years now that our fundamental responsibility in system safety is to create foresight about the changing shape of risk before anyone is harmed. To me, it's about the issue is what kinds of actions and what kinds of information do we have a responsibility to go out and dig and find for in order to steer in one direction or another. The outcome is uncertain, and then afterwards we'll be able, the responsibility then is to learn and change, right? So how do we learn and change, and how do we do that before harm builds up? Now, and there's a twist in our situation though, and that is we're in the middle of it, and we're all actors in it. And the scale of the pandemic as a rolling series of outbreaks means we have opportunities to learn from other places that were hit earlier, to see what worked and what didn't work. Granted, there's uncertainty in the information and evaluation and the credit assignment or the blame assignment of what factors in a complex situation work. But that we have a responsibility to dig into those and pick, that we can discriminate. There really is some evidence available to us now, and we can lean one way or another way in what we do. So to me, the argument comes down to this excessive deaths point, which is we will be able to know reasonably objectively eventually about what were the excessive deaths by some bad policies, some late actions, some ineffective action profiles from different jurisdictions and regions relative to ones that did well. And there will be people putting out papers with these excessive death calculations. And my current estimate, based on what I'm seeing across the areas that have broken transmission and built up medical responsive resources for hospitalized and ICU care, is they can keep fatality rates well below 1%. And places that are getting slammed, right? The people needing hospitalization, that rate is going up faster than they can generate capability in the medical system. They get slammed. And no matter how diligent and heroic the frontline personnel are, fatality rates are higher. Acting early looks like it has unnecessary offsetting costs, but if you wait till you're trapped and trying to respond to a overload of critically ill patients by an overburdened healthcare system, you have even bigger economic impact, and you have more dilemmas about how to implement actions to get the transmission rate down and to build activity that is constructive and helps.
There is no right time to intervene. Either you're too early, and when you're too early, you make the evidence of the necessity of the intervention go away and everybody protests, or you're too late and you're always behind the curve, and whatever you do is not going to make the problem go away. And so, and we could show this mathematically, right? So how do you ethically talk your way out of that fundamental bind?
Well, I mean, I think my whole argument for these on several decades you're referring to has been that we have to have replace that ignorance in the Graham-Greene quote with the wisdom to understand these empirical regularities that early, even though the information isn't definite, ends up being better. The problem is if you're early and effective, you will hide the evidence. And this is what I wrote about in the sacrifice decision in the first resilience engineering book, right? But that it's inevitable we will if we don't find the balance between the efficiency costs or productivity costs and the ability to have some foresight and act before information is definitive, then the only way we can learn and improve is by retrospectives after large degrees of harm have occurred. And I'm not willing to accept that we have to be in that position. I'm just not willing to do it. I mean, my whole career is we cannot. So in a sense, it's a personal argument, right? That My investment is that we can find ways, and that there are not just moral principles, but there's fundamental technical principles about systems, complex worlds, adaptation, and whatever, and even mathematical expressions of those in some limited cases that capture the way we can balance it, and that biology finds some ways to balance this. Because otherwise, if you wait until the major harm occurs, the major injury, the collapse of a system, like Boeing in the aftermath of the 737 MAX accident, the degree of harm can be a threat to viability. In other words, the organism dies, the company dies, the species dies out.
But we're already there. I mean, empirically, that you get worked up about not intervening early enough. We're already there. We haven't. Which takes us back to Hobbes and John Locke about when it comes to if you want intervention early, you need a populace that is willing to alienate its rights to some sovereign, to a government that says, we're intervening, we're locking you down, we're taking liberties and freedoms away from you. Yep. And in fact, we're taking rather fundamental liberties and freedoms away from you. And let's be very clear about this. Some countries in the world are actually have leaders that are capitalizing on the opportunity. They are wetting their lips, going, "Oh my God, I've been waiting to neuter my democracy in a way
now
that
I can finally consolidate my power." Yep.
Exactly.
Communication in the United States has become strategic. We're no longer getting good information from political leaders when their communication is strategic around consolidating their authority or elevating their position in the electorate. Now, as scientists, we have the wherewithal to look past that, but the public has access to the press conferences in a way that's much more easy than access to scientists who are communicating uncertainty and complexity. The public wants to know what to do and what's going to happen.
But it's already pretty biased in which sources they will lend credibility to and which they don't in a divided country like yours. The New York Times yesterday had a beautiful, if incredibly eerie, headline, which is, where is the CDC in all of this? Where is the Center for Disease Control? There is, and back to epidemiology, if you look at the political economy of epidemiology, the opinion is crystal clear. Don't let politicians guide action. It's stupid. Give it to the experts. Give it to the CDC. Have a front person there, right? Nowhere to be heard because, well, lots of things. First, neutered, 2018, you disbanded, in fact, was it 2017? I think it was 2018. In the US, you disbanded that portion or committee of your national security apparatus that actually deals and prepares for outbreaks and pandemics like this, right? Not necessary, not politically expedient. We get rid of it. The entire negation and bullying of expertise to begin with in the political climate in your country doesn't help. It doesn't help set people from the CDC up for any success. We'll let Dave go.
Now that we're in a position where we must make the sacrifice decisions, what qualifies the experts to decide what to sacrifice? The CDC is not where the collective values of America are adjudicated.
No, but the advice that comes from there can bend even, or should be able to bend political opinion one way or another. And then it might be the task of politics to help anchor decisions like that.
All of the evidence is available in advance. All right, it's a mindset that discounts it. That says, it says we have all these things that come out about undersupplies of protective gear and other kinds of equipment and facilities that would allow us to ramp up testing or identify. Some of which we still have, some of which have withered away. Rather than reinforce and grow those, we undermine them and isolate them and let them wither away. And so we see a failure of competence and the ability to react when the challenge event occurs. I feel like that the frontline medical personnel holding up inadequate protective gear and running out and making do and
even in the Netherlands, cattle farmers, our dairy farmers are supplying their overalls and face masks to hospitals.
Yeah, and this is crazy. I think it's also the obsession on efficiency and leanness, all right, has eaten all the reserves away. And this virus, almost perfectly poised in its parameters to have a maximum benefit of the human sphere in its current configuration, is exposing the way that we have unbalanced a whole variety of aspects of the ways we live. And that ability to have some robustness and resilience is being eaten away. And at the core of it is that, many of these decisions cannot be made. The trade-offs cannot be made by on a basis of competence, right? But if you have competence, you can put yourself to have less or less severe dilemmas and trade-offs to resolve that require integrating a moral dimension. And, we don't have to make trade-offs about who doesn't get a ventilator if we can ramp up care. The findings from our studies and many others of beyond surge events in the healthcare system is that people on the front lines will keep adapting to try to take care. They'll keep reconfiguring the assets they have to try to take care of the people in front of them. And they will stretch, and they will stretch, and they will stretch to try to do that. But I think the data also shows that as they do that, the chances of more people being undertreated, right, relative to the severity and threat of their condition goes up. And so the excess death rate will be calculated, and it will be higher for those who let their hospitals get slammed. And it will be lower for those who, whether they grew the capabilities in the medical system or they reduce the rate and extent of hospitalization in patients, will be able to match those two curves. When you match them, you can keep the deaths low, and that will be the baseline for the excessive death calculation. I'm saying that there's actions that will make a difference in that excessive death calculation. And I don't know what the moral principles are. All I want to know is I did everything I could to make sure places came out on the good end of that, were the part of the baseline, not the parts that came out with the numbers of look how high excessive deaths were because these tactics and strategies were poor, delayed, etc. We have evidence from how to contain past epidemics on what are the good tactics. In the absence of any other information, deploy those. To not deploy them, right, seems to me to be back to the Greene quote, ignorance, right? And however the good intentions as framed by a particular moral or political environment in society, so they'll all have different good intentions. But in the end, when you combine it with ignorance, it will guarantee to leave the front lines where the only thing they can say is, I'm in the middle of a snafu, but I will press on and meet my responsibility and my duty, right, and sacrifice on many dimensions for that individual and group at the front lines for others.
And the moral clash that then, in fact, we push down to individual frontline people, Dave, and I find that almost that's where I get upset. Is these are people who work on the basis of deontology, on the basis of the duty ethic, right? They're the most important, in fact, sacred duty is the person in front of you presenting with an illness. It's the duty that a captain of an airplane would feel. The most important duty is to the lives that I have in my hands here. Fuel burn, whatever, economy of the airline, turnaround times, none of that is important. What really matters is the people who have entrusted their lives in my hands because of my skill and expertise. But what we are pushing people into already is a situation in which that fundamental ethical principle that drives them, that in fact attracted them to the profession to begin with, then gets intruded and overwhelmed by the ethical principle of utilitarianism, where you have to make decisions about who gets the care and who doesn't, who gets ventilated, who doesn't get ventilated, because of the lack of resources that you so acerbically paint. And that, I think, is immoral, is politically deeply immoral. Right? That if we don't resource the experts on the front line that do this work, we are asking them to forego their most sacred ethical principle that has attracted them and drives them, and in fact, ask them to make utilitarian decisions to say, let's get as much good for as many people as possible, but that does mean that some people don't get ventilated, and we'll let them die. That is immoral.
So we have the two intent and outcome, the two dimensions that I started with. In between these is a process. And this is where the frontline workers typically operate. They have procedural rules, they have a duty to commit to their jobs, and they have processes that they follow to try and realize the outcomes that we all intend. I think what you're saying is that these processes break down when they don't have the resources that they need to fulfill their duty. And it pushes them over into making these sacrifice decisions about who lives, who dies, who gets resources, and who does not. What I have assigned my engineering students to do is study the first fundamental canon of engineering ethics, which is to hold paramount public health, safety, and welfare. We don't know what the welfare part means anymore. These are essentially contested concepts at the level at which we're working with them right now. We have an idea of what health means in a pandemic, and we have an idea of what safety means. But right now, there is debate about what about unemployment? What about the young people who are not at risk of fatality or even not at risk of needing intensive medical interventions, who now will see developmental delays in their profession or in their career or in their education, or be unable to start their families or care for the young children who are also not at risk. This becomes a deeper debate of what we hold dear. It's not just a technical question of what we know and ignorance and the failure to realize our intentions. It's what are the sacrifice decisions that reflect our collective values? And I want to hear from Sidney on that.
I really like the way in which you paint up that health and safety, as opposed to welfare, are slightly less contested or difficult to define categories. Welfare, in this case, is exceedingly difficult. If anything, because it is the goalposts on what constitutes welfare in a situation like this are shifting the whole time. And I think you can almost go back to Abraham Maslow, and say, ultimately, when you put pressure on people like this, what matters? At some point, welfare doesn't matter at all. All that matters is health and safety for your family, right? And welfare be damned. I was planning to buy a house. I'm planning to get married. I'm planning to have kids. But you know what? I can postpone all of these things, and my forefathers had as well, because there was a war going on. So what will happen? There'll be a huge baby boom, right? And house prices will rocket up after all this nonsense is over. And we'll deal with it later. I can't finish my schooling. So what? I'll have to work until I'm 78 anyway, right? So I don't want to get out of school anytime soon, right? So I think much of what constitutes welfare is negotiable. There may be certain things associated with welfare, however, that if you start taking liberties and freedoms and rights away from people, and in fact, right, we're back to that discussion, when you ask people to alienate their rights to go to a supermarket with 10 people around them and have fun there, or have a beach party, when you take that right away, when you ask them to alienate that liberty, does that impact their welfare?
The origin story is this trade-off between security and liberty. Give me liberty or give me death. And part of the attempt to strategically consolidate power among political leaders is to pose it as a trade-off between security and liberty. You want some of that safety? You want some of that security? You must surrender your liberty. And it is no surprise that the United States, as heterogeneous as it is part of the forefront of the political debate compared with countries that have a history of centralized authority, that don't have the same origin story of liberty over security.
I want to take a slightly different take. And one of the findings Richard Cook illustrates very nicely in his Bone is Resilience talk is that in the adaptive world, all of our systems at all the levels, our current state, how we work, how we do things, is a kind of rolled up record of our experience and response to stress. Stressors arise, and how we respond to them is what makes the difference. This is also Toynbee's view of world history. And different kinds of societies draw on different aspects of their history and capabilities in order to meet challenges poorly or not so well. And and so if you look at this and say, I don't know how this fits into the theories of moral judgment, but to me, the issue is under stress, how do you respond? And that you can make some moral distinctions as well as a variety of technical ones back to knowledge and expertise and effectiveness and impact that it has on the problem at hand. But there's a moral dimension to that, your response to stress. And that moral dimension tends to be, and we lay this out in the fundamental principle of reciprocity, I am willing to come to the aid of others when they are under increasing stress and in danger in some sense, in the inability to cope with that stress or to continue to function in the face of that stress. And that principle of willingness to come to help others, to me, is also a technical principle, but it has some moral implications to it, or a moral structure from within which that technical aspect can play out. So as you see others starting to not be able to keep up with demands, how do you come and do things that aid their capability, reduce the stressors on them, et cetera? And if you can do that, if you can commit to that, then I think you have taken a kind of moral agency view that I can help people ride through stress. I can help a system. I can help a group. I can help a unit. I can help another layer. And this is back to what Sidney and I were talking about with the frontline workers and why we get so upset working so much at the sharp end or with the sharp end or being at the sharp end of systems, that when you don't support them, when you don't come to their aid when they're overly pressured for a variety of circumstances and trends, then there's some failing. It gets us mad. It motivates our work and motivates our energy and persistence to continue to fight for investments ahead of demonstrated need. Because by the time you demonstrate the need convincingly enough, you will be too late, or you will only recognize it's definitive in the aftermath of harm.
If I were to both summarize what you just said and then take the next step, what you seem to suggest, and on the basis of what Richard Cook in his lecture on bone and resilience beautifully illustrates, is okay, so we are sort of representing and embodying the rolled up lessons of how we've responded to these stressors before. What demands an explanation in that theoretical position, though, is why do we fail to learn? Why are we not prepared in that case? Because the argument would be really easy to make, well, we could have known because look at all of these previous cases. Why are we not like bone? Why don't we heal in ways that bone heals in terms of its resilience, responding to previously exercised stresses on its structure? Why don't we?
So the debate about that is first based on the fact that we have examples from Ostrom and others where, in fact, for a time, human societies at certain levels and in certain areas have, in fact, developed mechanisms that are able to balance that ability to be efficient, along with being resilient, to have investments in graceful extensibility and not just try to pursue optimality. And that the current society has lost that balance.
Why?
Way. Oh, well, that's another story and another recording as to why.
But I think important, though.
Empirically, it's lost that ability to balance. Now, we also come back and look at specific systems and where we can say when you have a mechanisms that support that balance and the inherent tension. And so they are dynamically stable in the sense they can keep adjusting and not lean too far one way or the other way. I mean, in that telling on a long scale of evaluating this and the real action and the real answer for you in this case is going to be how societies and how different societies learn lessons from the pandemic. And what is that mix of lessons? Are places who do poorly and have high excessive death rates, how do they interpret and internalize that stress? And what do they rely on? Ones that were able to perform well, what lessons and what do they take from them? The lessons of groups and frontline workers who were abandoned to handle the crisis without support, while all the backroom staff and levels of society pursued their own personal power, economic, or safety goals, ignoring their interaction with other aspects of an effect on the disease. So I think ultimately the answer for where we are going and what will happen is all going to be in what we learn from it. What we know from our work in safety is that learning after the collapse, after the major failure, is extremely difficult too. And the tendency to not treat it as a fundamental surprise. But again, we have success stories where people come to us and shift and then backslide. And we've charted out the evolution of the fundamental surprise striking, creating opportunities in some layers of the stakeholders to question and change their models and framework and approach. But that over time, there's a degree to which that starts to collapse back into a run-of-the-mill, typical kind of performance, forgetting the lessons and returning to a narrow pursuit of just efficiency.
Sidney asked, why? Why are we not learning? And I had to look it up, but I'm reminded of the famous Upton Sinclair quote. I believe it's from The Jungle. It is difficult to get a man to understand something when his salary depends on him not understanding it.
It's slightly, there's a lag in that though. And I think that's what hides beautifully in Dave's exposition. What I mean by this is this, and it takes us actually, it's a beautiful arc back to the original impetus to this conversation. So empirically, Dave, I think you're right, but I think Tom and I easily agree that there is no argument that we have shaved away so much to achieve so much efficiency that the balance is completely gone. Let me just give you two little data touch points, really tiny, but one is Arthur telling me that KLM, his airline, has long touted and been seriously proud of achieving a label of the most efficient airline in the world, right? Which works really great if everything goes according to plan and prediction, right? But right now, being efficient actually kind of sucks because you don't have the resources to intervene in a meaningful way. And you see what Eric would call scrambled control. Oh, let's get rid of the 747s right now. Yeah, as if there's a market for them, But and so the and then the NHS in the UK, right? What are we hearing? I worked with these people a bunch, and the argument is this was a system teetering on the brink for a long time already, even before any of this started hitting, right? And then they're teetering even more, right? And will it collapse as a whole system? Of course not, but it'll start collapsing locally, and already probably is. And so those are minor points of evidence for the case that empirically we have made that balance go away. I think the question that must be on the minds of most people who deal with conversations and things like this is, how can you sustain the political motivation to keep investing in this margin when there is lots of evidence that what you're doing is clearly good enough, which goes back to the whole drift into failure argument, right? How can you motivate people to keep investing in that